Mr. Chairman, thank you, Mr. Cohen, for your time with us this morning. And my colleague said that there's fear-mongering on this bill, but I would just like to point out that I read an article the other day that the Roofers Union backtracks on Obamacare and wants repeal or reform of the bill. So I don't think this is right-wing fear-mongering. I think when you have a union that's very concerned about Obamacare and wants its repeal or reform, I think that's where we have significant concerns that must be addressed. Mr. Cohen, are you familiar with Richard Foster, the actuary of Medicare?
I know who Richard Foster is, sure.
Are you familiar with testimony that he gave before the House of Representatives Budget Committee a year ago or so?
Generally, but not specifically, no.
In that testimony, he talked about the two central promises of the health care law that were unlikely to be fulfilled. One, that the bill will not hold costs down, and two, that it won't let everybody keep the current insurance if they like it. Would you agree with that assessment?
Well, I think, as I've said, I do believe that costs will be down relative to where they would have been without the Affordable Care Act.
So that's an increase then?
Well, if medical costs increase, then the cost of insurance is going to increase. But
so the promise was made that it would keep costs down.
Well, it will keep costs down relative to what they would have been without the law, and at least people will have the security.
So what you're saying is that we will expect then costs to increase?
At least people will have the security of knowing that if they have a serious illness, their care will be paid for, which they don't have today.
We are talking about cost increases.
Well, for someone who has never been able to have health insurance before, to talk about an increase.
What about the person who has health insurance? Are they going to experience cost increases?
I think it's going to depend on the individual situation. There are factors that will cause costs to go down. There are tax credits that are available.
Are you insured? Are you insured through the federal system, or do you have outside insurance?
I'm insured through the federal system.
Has your insurance gone down or gone up?
You know, I don't even remember what happened. I think we had a small increase this year, but we've had lower increases in the last 2 years than we've had for a long time before that. I mean, the fact that health insurance goes up is not new. I mean, that's health insurance.
But I think the promise that was made in the health care bill, if I'm not mistaken, the promise was made that this would lower the cost of health care.
Well, I think it will relative to where it would have been without the law.
So this is kind of like the Washington two-step when we say we're cutting budgets, but you're actually decreasing the rate of an increase. Is that what you're saying Obamacare has done?
I'm saying that I believe that health care insurance, and if you look at the total out-of-pocket costs that people have to absorb, will be lower than it would have been without the law. Yes.
So so that's an increase in costs because if it's going to be,
it may or may not be. Depending on
what is an acceptable increase under? I mean, what are you anticipating under this health care bill?
For women who've had to pay 50% more than men, you know, the effect will be to reduce their costs. For people who have had to pay out of pocket for all their medical care.
But reduce their costs even though their costs increase from year to year. It's just you're saying that what you're saying is that, oh, it might not increase as much.
I think it's going to depend on a number of factors, including the underlying cost of medical care.
Well, let me ask you this then. Will Obamacare reduce the cost of health care?
It will relative to what it would have been without the law, yes.
But you're saying then that health care will increase? That
will depend on factors that are external to the Affordable Care Act. It will depend on
maybe I'm not asking the question very, very clear.
Yeah.
Will health care costs be less next year after the implementation of this bill?
I think that will depend on
yes or no?
I think that I can't answer the question. I don't know what's going to happen next year.
So we don't know whether
I don't know what's going to happen to the underlying cost of medical care.
What about